Alice.
Hello.
Good morning.
This is Sarah. She'll be your nurse during the day. I'm going to be heading home.
Okay, hi Sarah.
Hi. So as we previously discussed, we do our nurse handoff report in the room with you, so we want you to interrupt us at any time if you have any questions.
Okay.
All right, Sarah, this is Alice Smith. Her date of birth is 4/2/1946. Alice came into the hospital on June 18th. She's a full code. Patient of Caramount and Dr. Burke for cardiology. Also seen by physical and occupational therapy. And on bleeding precautions. Okay. So Alice, when you first came in, you were feeling short of breath at home, and you had checked your oxygen saturation and noted it to be 85%. So your daughter Kate brought you into the emergency room. In the emergency room, we did blood work and noted that the BNP was 480. And so Alice was admitted with an acute exacerbation of congestive heart failure. Alice is now wearing 2 liters of oxygen and is setting 94 to 95%. But Alice, I see your oxygen is out of your nose. If you could just put that back in
Julie,
your nose.
you're right.
Awesome. Thank you
It's
so
so
much.
annoying sometimes.
So our main plan or treatment for Alice is IV diuretics. So Alice, we spoke about that new medication called Lasix, that water pill that helps get rid of the extra fluid around the heart and lungs. So Alice is experiencing one of the common side effects of Lasix, which is a low blood pressure, which can make you feel lightheaded and dizzy. So another new medication for you is midodrine, which is used to help increase your blood pressure. So in Alice's past medical history, she has congestive heart failure with an ejection fraction of 25%, diabetes, and normally has high blood pressure actually.
Okay.
Alice is awake, alert, and oriented. You have been out of the bed with the walker.
Oh, yeah.
So a banner 3 and a fall risk. So you've been calling us each time you'd like to get out of bed and walk around or use the bathroom.
Oh, yes.
Like we mentioned, she's wearing the 2 liters of oxygen, setting 94, 95%. Lung sound diminished. Alice is on telemetry monitoring, so we have that little box monitoring your heart, and we see normal sinus or regular rhythm on our monitor in the 70s to 80s. We are obtaining your weight every morning, which we are logging on your daily weight log, as well as your signs and symptoms of the congestive heart failure.
Right, my daughter saw that last night.
Fabulous. So she had lost 2 pounds overnight.
Wonderful.
And we are measuring your intake and output. Alice is on a heart-healthy diet. Moved her bowels last night. Getting up to the toilet. Skin is intact. And Alice, where is your IV? Could you show that?
Oh, it's in this hand over here.
So that's in the
Okay.
right hand. That's a 22 gauge. And right now we just have a run of potassium because side effect of the Lasix is lowering your potassium level. So we're replacing that through your IV. Otherwise, I think we spoke about our significant medications, and otherwise the plan for today is to have a follow-up echocardiogram. Sarah's going to be rechecking your vital signs shortly this morning and repeating some blood work.
Okay.
Do you have any questions for us about the plan?
No, I think I understand, even about that new med. My husband will be in at lunchtime to visit.
Okay, very good. So from 11 to 12, I'll be in with the doctor's rounding, and if there should be some updates at that time that we can go over with your husband. At 9 o'clock you should be going for the echocardiogram. Also at that time we do need to get more blood work, and then also again at 3 o'clock this afternoon I will be also obtaining your vital signs in about a half an hour, and then again in 4 hours. Do you have any other questions?
No, not at this time.
Okay. Did you order breakfast?
Not yet.
Okay.
Oh, I have a question. If I'm eating and drinking, can this IV come out soon?
So after we get your blood work, depending on what it shows, we can then determine how long the IV will stay in, but we most definitely will still be giving you Lasix, so most likely we'll at least be having it for the first 24 hours you're admitted.
Okay.
Okay?
All right. Have a great day. You're in great hands with Sarah, and just feel free to press the red button on your call bell if you need anything or have any questions.
I think I have everything. Thanks, Julie. You get home safe.
Thank you. Stay well.
Okay. See
And
you
I-
later.
And I will see you in just a little bit. Call me if you need anything at all, okay?
Very good. Thanks, ladies.
You're welcome.